Good morning, good afternoon, wherever you are in the world. Welcome to our Thursday Live here at the Association of PEMF Professionals. I'm Jerry Dreessen, and I want to welcome you to our weekly live broadcast. And today starts our three-part series on what we call the brain, the bone, and the body. And what we thought would be kind of fun here for the next couple of weeks is go through what we've got in our research area on our website. People are wondering about where can we go to find out more about PEMF and what it can do. And so what I want to do is walk you through some of these things as far as where we can go to find this stuff. And on our website, and I'll have a link here in just a minute. But today I want to talk about PEMF and brain health. And some of you already know this. That was one of the original things that PEMF was known for, was the brain as far as PTSD and depression. Some of you have seen my interviews with Dr. Toy up in Quebec. That's what he does, is he does PTSD up there. He has a facility with multiple PEMF machines and has done a lot of stuff for the military as far as vets post-war. So I want to just dig into a couple of the articles that are out there. And as you know, PEMF has been FDA approved for treating medication-resistant depression, and it's specifically known and studied as transcranial magnetic stimulation, or TMS. And you'll see in the research there's like an R, TMS, which is repetitive. That means you're doing it multiple times versus just a single treatment or a single session on that. So on our website, you can go to PEMFprofessionals.com/?S=TMS. You can also jump into our research tab and just type in the search phrase TMS is what that's all about. So, but if you go to this specific link right here, it'll take you to the page as if the search query has been put in, and it'll take you to all of the articles. So I just grabbed a few and I thought I'd talk about them real quick so you can see some of the things that are going on, and you can grab this research article and read it and print it out and have it in your book if you're going to go out and market yourself. Again, going to health facilities, setting up and doing on Veterans Day or, Flag Day, or, treating vets and, branding yourself as somebody that does that. So here is the first article, which is slow frequency repetitive TMS reduces fibromyalgia pain. And so what this article talks about is how antidepressants have some symptomatic relief in treating pain disorders, but the repetitive transcranial magnetic stimulation is a new antidepressant treatment, which may also be useful in treating chronic pain. So this article goes on to talk about how using this PEMF, or they call it TMS in their articles, how it helps decrease overall pain, or what they're calling fibromyalgia. And fibromyalgia is probably one of the most broad-based diagnosis you can get. It's usually pain that you have that they can't find the origin for, and it's in your body, and now you have fibromyalgia. And it's a real thing. I mean, it can just be muscle. Those of you that have it know it's muscle pain. It's this broad base. It can be in any part of your body, and they're showing some pretty good results using this treatment or sessions of RTMS. Now, the next article talks about high frequency repetitive transcranial magnetic stimulation of the dorsal lateral prefrontal cortex in schizophrenic patients. So, prefrontal cortex, dorsal lateral part of it. So, they're actually targeting a specific part of the brain. And during this care, they've been investigating what it does. And the take home on this is the brief psychiatric rating scale decreases under the treatment. So something's happening in the brain that makes it work better, and it helps people with schizophrenia come out of it, and it noticeably. So we know that it does something in the brain. We're not dissecting the brain to show exactly what, but this is where you're starting to see some really cool research prove what PEMF can do. The next one is the effects of repetitive transcranial magnetic stimulation in the patients with Parkinson's disease. And you've probably seen some of these videos of people using it with Parkinson's, and after using it, they're able to walk, they're able to talk. It gets rid of the dopamine jitters that people get when their body is lacking that. Effects of short term, which is treated in 5 successive days. And there's a difference between how long they were treated. It's a great article, but again, lots of really cool science coming out. So here's one on Parkinson's. So if you have somebody with Parkinson's, you can take a look at that. That was a Japanese study that was done. The next one is the effects of repetitive transcranial magnetic stimulation in patients. Over the left prefrontal cortex as far as enhancing reasoning. And so they did tests on this with 16 normal volunteers as far as being able to, okay, let's take a normal brain and put this over an area that is known as far as the brain part for analogical reasoning. And then they tested them, and they found that they had a better overall performance than those that just had some sort of a sham treatment. So that's it doesn't say double blind. Double blind means that the people giving the treatment don't know what's real and what's not, and the people receiving it don't know what's real and what's not. So this looks like it's just a blind study where the people getting it don't know if it's real or not. And there was definitely a significant difference in what was going on for that. And then also, the last one that I'm going to talk about today is repetitive RTMS in major depression, which is what we've been talking about. The relation between efficacy and stimulation intensity. So they were looking at treatment times, how long it's left on there, and the effective size and stimulation conditions as far as varying greatly. And that's kind of the controversy, is like, do you go low for long times? Do you go high for a lot? And they looked at the intensity, the frequency, and the localization of the coils, and whether the antidepressant efficacy changed with those symptoms. So I recommend that you go over to our site now and take a look at this. This will be available for members as we rebuild our website. A lot of this is going to go on the membership side. So those of you who aren't members, now's a great time to take a look at these things. And if you are interested in more about the brain and PEMF, I want to welcome you to come in and join us. We've got lots of great articles, again, interviews with doctors that are using this in the field. That's on the inside of our membership site, so you can learn more about that. And we're going to be moving on our 3-part series, and next week we'll be talking about PEMF and bone. I want to thank ChatGPT for helping me with today's artwork with what's going on, and some things that you can do if you're a member. Share it, like it, our Facebook page, our LinkedIn. We've got YouTube and Instagram. You can go to all of those places and just tick know, like, trust, and leave a comment. And that'll help, again, our algorithms show up. We're over 1,000 members now, and we're continuing to grow. And the more that we can share this information out there with other people that are either interested in getting PEMF or are just starting to use it and don't necessarily have a company that educated them, that's what our national organization is all about. Those of you that are members know that. And if you're thinking about becoming a member, I definitely recommend you hop on and do that. Go to our website. Again, we're getting the AOPP version. I think this will be 3.0 upgraded. Lots of great things coming on that website. And questions or tips, things that you're doing that are working, definitely drop us a line at info@pemfprofessionals.com. And I want to thank you for your time today. And I look forward to talking to you next week about PEMF and bone health. And with that, take care, and we'll talk soon.